Why is healthcare still so expensive? And what would it take to finally drive down the costs? Today on RPI Tech Connect, we're getting real about the hidden drivers behind the price of care and the different levers that organizations can pull to move the needle. We're back for another episode of RPI Tech Connect. I'm your host, Chris Airy, and today we're tackling a question that affects just about everybody listening. Whether you work in healthcare or you're simply a consumer of it, you know that costs continue to go up. Today, we're going to talk about what's happening inside healthcare and what can be done to make it more affordable. I'm joined by returning guest Brian Rosenberg, who has spent years working across healthcare, technology, and operations, and brings a grounded perspective on where costs come from, as well as how to reduce them. So Brian, welcome back to the show. For anyone who's meeting you for the first time, would you mind sharing a little bit about yourself?
Sure, I'm happy to. Thanks for inviting me back, Chris. So my name is Brian Rosenberg. I have been working in technology implementation in the healthcare industry for about 27 years now. I have been involved in implementations of ERP. I was the founder, actually, of RPI way back in 1999. I have helped with projects ranging from implementations of Infor and other ERP systems, helping with selections of run electronic healthcare record deployments, and many other projects leading change and transformation in the industry, building shared service centers and other things. I currently teach at the School of Public Health at the University of Nevada, Las Vegas, where I currently reside. I also am on the board. I'm in the vice chair of the Health Information Exchange here in Nevada, sharing healthcare records. I'm an honorary commander at the hospital at Nellis Air Force Base and the president of the Health Information Systems Society, commonly known as HIMSS, Nevada chapter here in Las Vegas. So I very involved in the healthcare industry and speak and write about issues in our industry often.
I was going to say, Brian, you cover like every area within healthcare too. It's not just back end, it's care, it's politics, it's everything.
Like it's easier as you get older to have all that experience, but that's that has
Well,
been quite a work.
Yeah. I'm looking forward to hearing your thoughts today. I think a great place to start today's discussion is with this very big and simple and important question, and that is, why is healthcare so expensive?
Well, certainly that's a big question. And I think that people think that healthcare is expensive because doctors and hospitals are getting rich. But the reality of it is that hospitals work on extremely thin margins, usually single percentages, often 1%, 2%, 3% kind of numbers. In many cases, unfortunately, hospitals are operating at losses. And I think we assume that they're doing really well. And individual doctors as well, certainly doctors are well paid in comparison to much of the rest of the population, but they also have very heavy debt load that comes with that education. And certain types of doctors are paid much better than others. And the reality of it is that the doctors who provide us with primary care, the first line of support, are often the lowest paid in the industry. So I think, overall, I think that there's a perception that because we pay a lot for healthcare, that means people who provide healthcare get a lot of money, and that's what it does. But the reality of it is much more complicated than that. And in healthcare, certainly there are many factors. But I think an area that I see as a major aspect of that is that healthcare is expensive because it's complicated. Because we have very large and expensive software systems. We have very complicated processes to track billing and to bill all the insurance companies under all different rules. We have to provide care in very particular ways to meet lots of regulations and many of them on the surface are very valid and have good reasons to exist, but they create complexity. And I think a lot of where we'll end up talking about today is healthcare is expensive because it isn't necessarily efficient. And there's many different reasons for that. But we don't do a very good job as an industry of sharing medical information for the purpose of providing better care, something that I can get a little passionate about. And we, as a result, have challenges with duplicate care. We have challenges with people waiting to get care until the last possible moment when it's most expensive to provide. People not understanding the right place to get care, going to the emergency room for something that they could go to an urgent care for example. All these are factors, and we can get into all of this. And then there's just general efficiencies with the back office. And one interesting stat that I've shared in different presentations is one from the Brookings Institute, which shows that 1/3 of the cost of care is related to the overhead of healthcare, not actually providing healthcare itself. So that there's a lot of answers to that question, and certainly dive into many aspects of that. But that's the reality.
When you say overhead, is that like, operating the building and the machines and the staff who work at the hospital, or?
Getting into everything from back office to to billing functions. It's interesting too. We have a difference in that healthcare has gone towards a very large organizations, commonly refer to them as IDNs, integrated delivery networks, that have many, many hospitals, and they acquire a lot of hospitals, and there's less and less private or independent hospitals in the industry. But what happens is that they build large shared service operations that provide efficiency. But the smaller independent hospitals struggle more and more to be able to be efficient in the complex world that they operate in. Yeah, I had led an Epic implementation for a hospital. It was a 550 bed independent hospital, and the CEO would ask me, why do I have to have so many people in IT or in revenue cycle? They had over 100 people doing in the billing department. And one thing I would tell them is that you have all the complexity of a healthcare system 100 times your size without any of the economies of scale.
Resources. Yeah.
And that's a challenge as well. And it's harder and harder for independent hospitals to be able to keep their costs reasonable in many aspects, everything from supply costs to efficiency of staff. But in thinking about that overhead, that relates to the costs related to running IT, to running billing, to running registration, to scheduling, to all these functions that ultimately are necessary in order to be able to allow patients to be able to get care, but impact the cost of care. And I think, in the end, these are things that are somewhat invisible to somebody who may be a patient and not in the industry. But in the end, everybody's a patient and everybody's affected by these costs.
Do you think, is there an oversimplification of the problem here? Like, I feel like a lot of times people like to point at one thing in particular for why healthcare is the way that it is. What are your thoughts on that?
Yeah, I think absolutely that there is an oversimplification. I think that, when we look at this politically, and I won't get into debating political issues, but I will say that our politics tends to focus a lot more on who should be paying than it does on the cost of it, right? So it's a lot about what patients should pay for, what insurance companies should pay for, what the government should pay for. That's not the issue that I want to get into today that I think is important to the cost of care. The question really is ultimately your original question: why is healthcare so expensive to begin with, regardless of who's paying for it? I think there's more visibility into this lately because insurance deductibles are going up. More and more people are finding that the care that they pay for is much more relevant to them and more noticeable to them. I personally, I have 3 kids, and so I have a family of 5. And my insurance rates, in the microcosm of my world, but the insurance plan that I was under here in Nevada, to keep the exact same plan I had, the insurance rates were going to increase by 40% this year to keep the exact same plan. And that's more than the average. I believe the average in our state was more in the 20 to 25% range, but the plan that I had was increasing 40%. To get to that point where my insurance only increased by about 20%, I had to go from a $5,000 deductible to a $9,000. I had to go to a plan that effectively doesn't pay for anything until I hit my deductible, go with an HSA, which means that I'm now a true consumer of healthcare and I pay for the majority of it myself until, ultimately the insurance is there if a crisis occurs. But I think more and more people are making those kinds of trade-offs. And as a result, they're becoming more aware of the cost of care directly because they see the bill. And I think, I'm actually going to mention, the seeing the bill aspect of it too. I think that one of the reasons there's misconceptions about healthcare costs is that in healthcare, we have a dollar amount that is sort of the default price and then what people actually pay. And there's a big gap between those. In the industry, we refer to as gross revenue versus net revenue. Basically, there's a price that is the rack rate, if you will, that is not what actually gets charged to an insurance company or to a cash payer, which is really high, but ultimately not what gets reimbursed. What actually gets reimbursed is negotiated with the insurance companies and tends to be much lower, significant.
You mentioned something there that I think is a great way to think about this discussion. It's not pointing fingers at who should be paying more for the cost, but rather how do we bring the cost down as a whole? I think that's the right way to think about this issue.
And if we solve that problem, then who's paying is less significant of a factor because in the end, we worry about who's paying because it's so expensive, right? So we can solve the problem of the cost of providing care. Then ultimately the who becomes easier.
You mentioned something there about earlier on, folks sometimes not knowing where to get care for what type of, procedure they need or diagnostic or where to go, when to go. And it seems like there's just maybe this lack of general knowledge on what healthcare entails, what it gets you, and how to use it effectively. I believe you had a stat you mentioned once before about like people using ChatGPT to like understand health insurance. Could you share that?
Yeah, let's talk about this issue because I think there's a lot of fundamental issues around cost of care and ultimately the idea of people's ability to control their own care that comes out of this. And I'm gonna go a few different areas in this, and we can dig into different aspects of it. First, I want to mention the idea of ownership of medical records because there's something fundamentally broken in our industry in the idea that we think of it that the provider of care owns the medical record, as opposed to us as a patient. And we need to take control of our own medical information. As I mentioned, I'm on the board of the Health Information Exchange in Nevada, Healthy Nevada, which is a not-for-profit, which facilitates the exchange of medical records between providers. But here in Nevada, like a lot of states, we do not require providers to share medical records with other providers through the Health Information Exchange. So if you've ever been to a doctor's office and filled out a form and had to remember everything about your medical history and wonder why you have to do that, it's because they're not pulling up that information electronically, though generally that information is available electronically from someone. It's available with the Health Information Exchange in our state, but there are health information exchanges in most states. Actually, 49 states have health information exchanges. So it is something where you do have the ability to get access to that information. But is it complete information? Is it fully accurate? Depends on some of the rules and how that information is collected. But fundamentally, this is important because we go back to that aspect of cost of care. And if my doctor doesn't know the results of a MRI that I had, because they can't get them or because it's going to take weeks for them to get them, and they have to wait for someone to fax them over to them, then they are probably going to order another one. And we end up getting a duplicate test, and that affects the cost of care. That's exactly the kind of thing that affects the cost of care. And when you look at, when you think about it, that we don't have all the information and nor necessary to be able to tell our physicians and have them be able to see that complete history to be able to make the best medical decisions. And I'm going to, and tying that into that question about a ChatGPT, and actually timeliness of this is good. And that OpenAI announced a ChatGPT Health just a few weeks ago. And we think about it in terms of there's a lot of fear about that solution in the healthcare industry, a lot of concern. But here's the reality. Patients have been self-diagnosing for thousands of years, well, pretty much since the beginning of the existence of man, we've been self-diagnosing our own health. The question is, what tools do we use to do so?
To do that.
Um,
Yeah.
yeah, and it could be as sophisticated as something like OpenAI's ChatGPT solution. It could be using WebMD. In many cases, people are calling up their grandma and saying, what should I do? And she says, you know, yeah, it is the reality that we do that, and why we've been trained to do this
Because
is an
it's
important
cheap
question.
and because it's free, maybe?
Cheap, free, and there's one more I would add to that, and that's fast, right? And that
Okay.
and that and that if even if healthcare was free, right? That doesn't necessarily mean you get an appointment, right, in a time to matter. And anybody who's been a parent knows their kid gets sick. You can try to take them to the doctor but you can't get an appointment for 2 weeks. You're not going to wait till your doctor's appointment to try to treat your kid, right? You're going to make a decision. You're going to make a judgment call as to what's the best thing to do. So there's a question of, can I afford to go to the doctor? And there's a question of, can I afford to wait to go to the doctor? That leads people to self-diagnose a lot. And we've somewhat become trained to self-diagnose as a result. But there's also the reality that a lot of things can be self-diagnosed. And there is an aspect of, when you think about what can be effective care, right? That a doctor who has 5 minutes with you may not be able to provide the same level of depth of looking at your situation than a solution that has all of your medical records, right, and all of your history, and can ask you questions about your conditions and knows everything about your past conditions and can help you to understand what might be the possibilities. It's reasonable for people to think that, right?
Yeah.
The best answer ultimately is going to turn out to be combining a physician who is accessible and ready and available and affordable with automation tools that allow both the physician to be able to provide care more effectively and the consumer, the patient, to come into that care more informed. So when they get the time with the doctor, they can ask smarter
Right, of
questions. They
course.
can have better understanding about what their history is relevant they should bring up. So there is a place, a very important place for these solutions. But what you don't want is ultimately people putting off care. That's the worst case scenario. And when we think about, again, coming back to that who pays questions, there's a lot of debates right now about what do we do, who should be on Medicaid and who shouldn't be on Medicaid, and reducing the number of people on the Medicaid rolls. An important aspect of that to realize is that just because somebody doesn't have Medicaid or any insurance doesn't mean that they don't get health care. What it means is that they wait because they can't get health care until eventually they show up in an emergency department with a much more serious condition. And at that point, the hospital is not going to turn them away. They're going to treat them. They're just not going to get reimbursed for it. And when they don't get reimbursed for it, what do? Well, they have to increase the cost for everybody else. So inevitably, the incentive for everybody should be to provide
Good.
people with the right care at the right point and time to prevent those issues from becoming more serious.
Wow. There were a lot of layers to everything you just said there.
There's,
Um,
there's a lot of layers to this problem.
yeah, and so I want to talk now a little bit more about the solutions that you touched on there, like the AI being able to like provide your medical record history into the solution so that the physician is better equipped and like knows more about your history before you get there, and at the same token, the person who arrives um, is better informed to ask smarter questions with the limited time that they have. Does implementing something like that, like from the hospital's back end side, like what does that look like? Is that expensive? Does it take time? Is it? I'm sure the answer to those questions is yes, but how do you recommend that they think about doing something like that?
Well, there are very specific solutions around care, electronic health record systems that are commonly used for clinical and scheduling and other areas. But what you're going to see a lot of is AI driving enhancements to these applications, both AI put out by those providers, those platforms, as well as AI from third-party solutions. I think there's an incredible opportunity in AI to make care more efficient at every stage. And this goes into the front office of healthcare, patient-facing stuff, and it goes into the back office of healthcare as well. From a front office perspective, if we can schedule online, it becomes more efficient. We have to take less staff. If we can use AI to help to find a more appointment using natural language to make it easier for someone to schedule, it becomes more efficient. If we can use AI to make sure that the bills are right before they go out the door so the insurance company doesn't reject it, then we are making care more efficient. So there's a lot of aspects of that. But, within the care environment itself, one thing that many of you may have seen that I think many, many more will see is what's called ambient documentation, which is where you go to a doctor's appointment and the doctor may ask for your permission to record it. And now, instead of the doctor typing into the computer the whole time they're talking to you, the ambient documentation is listening to your appointment, creating the notes for the doctors, even transcribing the orders for the doctors in some cases now. So the doctor can actually look at you while they're treating you, and they can spend more time with you because they don't need to spend the time documenting in between appointments or after what's kind of called pajama time when they're working at home, complete the documentation for the patients that they've seen for the day. So those things free up the caregiver's time, which allow them to spend more time with us or to see more patients. And ultimately, I think that's where there's so much opportunity in AI, every aspect of how we're providing care in order to make care faster, more efficient, and more effective.
So it sounds like AI is definitely a part of the solution here. If implemented correctly, save time and doing some of those manual tasks like taking notes during the actual appointment, and providing care more effectively in a shorter amount of time. I want to talk about another aspect of the overall healthcare costs, and that's this administrative portion. One stat I've heard floating around is that roughly 20% of healthcare costs are administrative. What's baked into that stat? What can you share?
Yeah, and I think it's higher. I'd look at more like a third, but administrative, basically think of it as back office functions, and I'm going to divide that up into two sections. There's back office functions that ultimately support the clinical operations, in terms of basically the scheduling, the billing, types of functions that typically are done in electronic health solutions. And then there's back office functions like HR, finance, supply chain that are typically done in an ERP solution. And when you look at, and you take this, we're going to talk a little bit about that clinical side. When you look at the back office, the ERP side of it, there's many aspects of it. When you think about supply chain, a lot of it is about keeping track of what we have and making sure we have the right product delivered to the right place at the right time. I think in that case, this is again something that's not necessarily visible to a patient directly, but when a surgery gets canceled because the product isn't available, the problem. The pandemic, I think, taught healthcare organizations a lot about how dependent they had become on the distribution channels that serve healthcare. And just for those who may not be as familiar, healthcare is heavily served by just-in-time inventory models where you have distributors who stock large quantities of products that you commonly use. And those distributors operate in nearly every major city or within driving distance of every major city in America. And so healthcare organizations became very used to the idea of being able to order product just in time and be able to get it the next day. And when the pandemic hit, many products disappeared from the supply chain. And healthcare organizations had to learn how to source in real time. And inventory management became significantly more important. Understanding what do we have? What do we need? And we've learned lessons from that and learned that we need to be smarter as an industry about stocking the right amount of product, about having multiple different sources for different products. So we're not reliant on a single vendor. doing a better job of understanding substitutions, and doing a better I mentioned those integrated delivery networks, do a better understanding of really even what we have within our healthcare systems. One thing that a lot of providers didn't really know in early on the pandemic when they were looking at masks and other things was, where do I have product within my own system where I can just move it around? And there weren't good processes in place to move inventory within those systems, and they had to adjust all that. This whole idea of inventory intelligence and really understanding what we have, what we need, predicting what we need based upon what surgeries and other things we have coming up, based upon seasonal, things like, we know based upon prior years that flu season, we typically need more of this product, and being able to have it in, I think creates an incredible opportunity for us to better manage and understand supply chain and sourcing better, to understand where can we get product? Where's the right place to get it? And factoring in, sometimes it's not as simple as who has the lowest price, because we have to think about rebates we have negotiated and volumes we have to give to particular vendors as part of negotiations. And that requires much stronger analytics and AI to be able to understand what's happening. There's examples in HR, staffing and optimizing staffing, particularly with nurses and other areas where moving around of staff becomes really important. And optimizing the people that we have based upon need, which, in a geography, we may be short on nurses in one hospital and have an excess at another hospital. And being able to move that around reduces the cost of care, reduces the dependency on travel nurses. And you get an area like finance, really having real-time visibility into our costs, being able to, understand how to better manage cash flow so that we are paying things at the optimal time, which might mean paying on time, might be paying late, depending on our cash situation, might mean making sure we're taking all available discounts. These are all examples, and I realize that I'm throwing out a lot of them. But each of these are different areas that needs to be looking at, how do I run at the maximum level of efficiency while still having a systems view, right? We don't want to make the trade-off of keeping inventory low if it means that we're not going to have the right inventory at the right time. You have to look at the end-to-end impact of these decisions, having a systems view of it. And at the same time, how do we make each of these operations more efficient? Use AI as a tool where appropriate to make it more efficient and to give us better information to make informed decisions, because every aspect of that impacts that cost of care. And if we're going to get that 1/3 down to 15% or 10%, everybody needs to be all in on that, and looking at their areas and driving that kind of cost improvement and process improvement route.
It sounds like then that like the back office operations can be but an important lever for healthcare organizations to try and cut down costs, because like this is where sounds like there's waste in supply chain and maybe inefficiency and maybe even lack of visibility into certain things that could drive down costs. Does that mean then that like a good ERP is a critical role in driving down healthcare costs? Can we draw that conclusion? Is that part of the
Absolutely. I mean, and I think that a good ERP, mentioned that there are two aspects of that. There's the software itself, right?
Yeah.
But I think one thing that is really important to realize is, I don't care if you have Infor, Workday, whatever ERP you're using, Oracle, it doesn't matter in terms of that. Your responsibility around that ERP did not end the day you went. You have to have these solutions. And optimizing solutions is not even a technical. I think that's often thought of as IT's job. It's technical. Optimizing, to me, is using data in the system to drive continuous improvement in your organization. And while an IT role could be making that data available in good reports and dashboards and creating visibility, the operations needs to be defining what we should be looking at, what actions we're going to take upon that information, setting goals and targets that are not unrealistic, nor are they too easy, right? We want to establish realistic, attainable goals and measure people towards that and build an environment. And I apologize, I'm a Lean Six Sigma master black belt, so I talk about this kind of thing a lot, that the idea of creating a culture of continuous improvement. never accepting that the status quo and where you are is good enough, always trying to make it better. That's the whole concept of Six Sigma, constantly driving improvement. What you're doing now is never good enough. Now, you may focus on one thing as opposed to another thing at the moment because of priority, but always driving improvement at every aspect. And every department manager and every overhead function should be thinking about that every day and how they make those numbers better. But what numbers should they be looking at? What are the numbers? What do they do with those numbers? That's part of what we need to help people to understand.
You meant earlier you said it didn't matter if it was Workday or Infor or Oracle or some other system. Previously, I heard you mention that like healthcare is one of the biggest industries still using the fax machine. Does that say something about the lack or like the lag in modernizing systems? Like, is there a lot of hospitals that are maybe operating on-prem still? And like, should they move to
Yeah,
the
there's
cloud?
a
Is
lot
that
of
part of
people.
the solution? Yeah, go ahead.
Absolutely, a lot of, I think probably more so than what you would see in other industries, a lot still are operating on-prem, and it's time to get into the cloud. I think we're past understanding, we're past the resistance to that, right? It lowers costs. There's plenty of effective security. As a matter of fact, I would sleep a lot better if I was a CIO at night, knowing that my information was in the cloud, where a vendor who has extremely large investments in security is maintaining it. And hey, worst case scenario, if something happens, there's somebody to hold accountable for that, right? As opposed to the realities that vulnerabilities that can happen with our own staff if it's on-prem are just so real. I think that is a fundamental factor. But then there's just the aspect, a lot of the things that we're talking about doing and modernizing and using AI tools. There's just going to be more and more restrictions on-prem. They're already incapable of using a lot of the tools like AI that are out there in many of the different solutions. And I think that there's an element of just that increasingly the organizations that don't leverage these tools to an extent, and we'll qualify that there absolutely are right and wrong ways to use these tools. That might be a whole conversation of itself. Yeah, but they are a part of how we need to be providing care. And if you don't do so, you're just not going to be competitive anymore. I mentioned like ambient documentation. Doctors are going to get to the point in the next few years where they're not going to want to work at hospitals that don't have ambient because it's more work for them if they don't. That shift is going to be happening across every role, and we need to be teaching our staff how to use the tools, including AI, including data, better. And cloud environments are just better prepared to provide us with that, and to allow people to focus on what's important, which is driving down the cost of care, not maintaining servers.
So a lot of these different things we've talked about here, from the ambient, what'd you call it?
Ambient documentation.
Ambient documentation, cloud ERP, automation, AI. There's probably a hefty price tag on some of these items, but implementing them sooner rather than later is going to help you down the road in curbing costs. Is that correct? Is that your belief?
Yes, and actually, there's costs obviously with implementing anything.
Sure.
But in relation to the cost savings we're talking about, it's not significant. The harder thing, I think, for beyond the financial investment, is the time investment is hard for a lot of healthcare organizations as well. It's hard to get the priority on these things. I think it's important to realize that this is what matters in us being able to provide better and more affordable care. And you have to invest in these things to impact the bottom line, because investing a few $1,000,000 in upgrading an ERP, to the cloud, is going to be peanuts in comparison to being able to better manage your staff, and make them more efficient. To be able to make sure you lower your cost of your supplies. To be able to make sure that your financial statements are more accurate. At the scale of what we do in healthcare, where smaller healthcare organizations still have revenues in the hundreds of millions or billions of dollars, um, it's just this isn't financially relevant to the big picture. And we, And from a cost standpoint, I think there's always the aspect of what I talk about sometimes, the Stephen Covey's habits, if you're familiar.
I
One of those
remember.
habits is sharpen. And I probably referenced this in our prior conversation because
It's
it
still
is so
relevant.
fundamental. Yeah, that it's and for those who are not aware, sharpen the saw is a habit where the story is that there's a guy walking through the forest and sees somebody trying to cut down a tree with a dull axe, a dull saw, and he says, "Hey, why don't you sharpen the saw?" And the guy responds, "I don't have time. I'm too busy trying to chop down this tree." It's so applicable to healthcare. I mean, to some extent, every industry, but in healthcare in particular, this is part of the problem. We don't take the time to sharpen the saw. We don't step back
Mm.
and fix our fundamental issues because, and no industry experience this is probably more than healthcare. That the patients, the fires of the day, what walks in the door of a hospital every day is unpredictable, and it distracts us from getting that work done. You have to have dedicated people to getting these projects done, whether that be a system upgrade and upgrading in for a cloud suite, whether that be driving continuous improvement and finding ways to reduce our supply chain costs, whether it be improving the scheduling process or implementing ambient documentation. The what doesn't matter for the purposes of this conversation. You have to have people dedicated to that or you get stuck
Yeah.
trying to cut down the tree with the bill set.
Well, Brian, I love that we've talked about this one lever that can be pulled to help drive down healthcare costs, and that is looking internally, looking at your back end office operations, and seeing where you can implement AI automation. Maybe it's a cloud ERP in itself. Like these are the things that are going to set you up your hospital for greater success down the road. And I thank you for sharing this with me here today. We are getting
Let me just
close to
address
time.
the API automation that you mentioned just briefly, just because it's something that I personally have a lot of history with.
Sure.
But yeah, and something we didn't really talk about. But with accounts payable automation, and I had the opportunity to design many accounts payable shared service centers during my time with RPI, including many large healthcare providers, all the way up to Common Spirit, one of the largest healthcare providers in the United States. But I think important to realize that that's a good example of an area where there's so much opportunity for automation that we have. That paying on time means taking discounts, means getting rebates, which means negotiating better discounts with vendors, means more visibility into financial information. And it's a good example of something that people don't think about that has so much opportunity. I do want to call out specifically the yoga solution that RPI has because as somebody who was a part of designing a lot of the process that I think yoga ultimately enables, I find it an extremely impressive application and a good example of something that combines automation with process efficiency, with learning in order to make it more effective. To just take a process that is something that happens in the back office that people don't think about usually until it's broken, and make it more efficient. And I think it's the kind of solution people should be looking at every level of the organization, and every aspect of what happens that's facing patients and care, and that happens in the back office. And last thing, before you close out, because I do want to mention this, because it causes important to me that medical record information sharing is so vital to all of this to lower the cost of care. Get control of your medical information. Get all of your medical information in one place. Support the need for electronic sharing of medical information in your state. It is vital to driving down costs. It's vital to controlling your own care, and making sure that your providers are delivering your care with the best possible piece of information.
Would you say that for people listening in who are thinking about ways that they can have, run their healthcare organization a little bit more efficiently, is accounts payable a good starting place for maybe trimming costs?
I think it is because in the end, every cost goes through accounts payable, right? That visibility is absolutely, and it tries into the idea that you need real time information, you need metrics. So it's a place to start. I think it's a good place to start. I think where you start maybe less important than that you start. And I would say start in many places. That's one good example. But and that comes down to that idea of building a culture, having metrics that you're driving each of these teams off of, that they're focused on improving. And understand how things, and AP is an example where everything that happens in AP affects what happens in purchasing and vice versa. Understand the downstream and upstream implications of what you're doing, so that you're not creating a problem somewhere else when you're fixing a problem in your area. And that requires visibility and consistent sources of information. Truth and data is essential to everything we do.
I love that you said you made that distinction clear there. It's like accounts payable is a great place to start, but what's most important is that you just get started, right? You gotta
That's right.
get this thing going. Don't put it off anymore. Okay, great.
I don't put it off anymore. I think that'd be a good key takeaway for people. That start and get and look at this from every aspect. Whatever. Obviously, many of the people listening to this probably control one aspect of that process. But create the example. Work with your peers in other areas. And I think we talked about with ERP as an example, Infor going to Cloud Suite, is a part of that, but don't end there. It's the process improvement is a never ending exercise, that we all need to embark in, because, that we're never perfect. And we need to constantly make things better, drive down costs, give more value.
Yeah, that's something that I know it's a phrase I use time and time again between blog posts and social media and on podcasts, but ERP is a continuous improvement journey. It doesn't end. You're not done on go live. There's always more to be done.
Right.
And I was going to ask you what your one takeaway is, but I feel like I may have just heard it. But if you had to just to distill it down into a 30-second nugget, what would you share?
I think I'd share, I'd focus on, for the practitioners out there, continuous improvement, drive improvement, use data, experiment with uses of AI to help with that, though it's not always the right solution. For patients, get control of your data, understand your own health. Ultimately, you're the only one who's going to truly care. And a big part of that is having control over your medical records, not your providers, not your electronic health record solutions, but having true control. And if you don't have the ability to do that, then support people in your state, politicians in your state who support you having that access.
Awesome. Both really great actionable takeaways for both audiences. I have one more question for you though. I don't think we alluded to it earlier, but you have a stat on chat. What is the figure of folks who use ChatGPT to understand their health insurance?
I had that. I think that they said it was something like 30%. I apologize. I had that number somewhere. It's very high, and I think that it's even higher than people realize. I mean, you can take your blood test results, upload them in the ChatGPT, and it will analyze them for you. The problem is it may not know your medical history, which may be relevant.
Context.
And you want to make sure that there's a little button on there that in your settings that determines whether or not it gets shared with the data model. You don't want to share that. I am seeing a movement toward, I think there's going to be more and more consumer facing products that allow you to be able to have more controlled environments, to have your medical records in a more safe and secure environment, and to ask questions about your own health. You can use the publicly available tools, but I think that certainly you don't want to be sharing your medical information, and there will be better and more specific tools for this purpose coming out more and more.
We might have to have a follow-up discussion on that when we're seeing more of that out there.
Absolutely.
Yeah. Sounds good.
Yeah.
Cool, man.
Yeah.
Thank you so much, Brian. It's been an absolute joy chatting with you again. Folks listening in, if you have any questions about today's discussion or you want to learn more about how ERP can help lower the health of healthcare, we'd love to hear from you. You can contact us at podcast@rpic.com. Again, that's podcast@rpic.com. This has been RPI Tech Connect, and we'll see you next time.